Hi, I'm Dr. Itunu Johnson-Sogbetun, also known as Dr. Show, a GP with a special interest in women's health and menopause. Today, I'm going to talk to you about heavy periods, which is a really important thing that affects many women. So what are heavy periods? Heavy periods are when a woman's menstrual monthly bleed is so heavy it's impacting her day-to-day life. Now, how to quantify that can be quite variable dependent on the woman, but we often say if a woman is having to change her pads every hour, if she's having to change her tampons or pads during the night, if she's having to have multiple prolonged days of a period, so more than 7 days of a period, and if it's impacting her day-to-day life, so if she's finding it difficult to go to work because of the heavy periods, then it's an impactful thing on the woman. So, how do we diagnose the causes of heavy periods? Now, some women have always had heavy periods, and sometimes there's a change in heavy periods. Now, more concerning is when periods were not particularly heavy and have become heavier because it could be as a result of something having changed in the womb. But if your periods have always been heavy and they're disturbing your quality of life, then obviously we still want to know about it. So what we would do is things like a full blood count and an iron count to check whether you've had a problem resulting from the heavy periods causing anemia. We would also often check things like an ultrasound to look for fibroids or signs of endometriosis or adenomyosis that could be making the periods heavier. Now, how do we treat heavy periods? We treat heavy periods with medications to reduce the heaviness, like tranexamic acid. If periods are also painful, we may use an anti-inflammatory medication. We also use hormonal birth control pills to help control the heaviness of periods. So the progesterone-only pill, also known as the mini pill, or the combined contraceptive pill. And very, very commonly, we advocate the hormone coil. And there are multiple types of hormone coil, but the most commonly used one is Mirena. We also use Kyleena, although that's a lower dose of the hormone in the coil. There are also surgical treatments. These are often for extreme cases. So there could be endometrial ablation or a hysterectomy in very, very severe cases. If you're struggling with heavy periods, we would love to see you at Dr. Showcare's clinic, where we will be able to provide a comprehensive assessment, investigations as needed, and treatment for non-surgical options. And if you require surgical options, we can refer you on. And our clinic is at St. Albans or on Harley Street or online.